This is episode number 2 of Sin's Chat Corner. Today I have opted to interview my own personal physician. As most of you know, when I do these interviews, I have been very meticulous about spending time not interviewing medical professionals, and in fact I did an entire series on medical misdiagnosis. Most of you also know, of course, that was in large part due to the fact that my husband had passed away due to cancer. So for me to be interviewing someone in the medical field, I think is a profound decision, and more importantly, it speaks volumes about the person that I'm interviewing. So I am finally getting to a place in my life where I'm finding physicians that I can trust. The particular individual that I'm interviewing today is an actual chiropractor, and that brings about even more reservation for a lot of us because there is not a lot of profound science about what circulates with chiropractic care, and more importantly, I had my own reservations about whether this would actually work and what sort of care I would get. So I'm very pleased today to be sitting down with Dr. Alan Van Scoyk, who owns 21 offices, and the name of the business is Chiropractic Company. Okay, Doctor, first question for you. You have been doing this for 21 years, correct? Talk to me a bit about what ignited the spark for you to say, I want to become a chiropractor.
So growing up, I was into everything. I was a very active kid growing up, and I loved to play sports. And so, unfortunately, I was one of those kids that was very competitive, and in many circumstances, probably overly competitive. And so I would always be the guy that would just go at it as hard as I could to win. And unfortunately, I sacrificed a lot of physical parts of my body because of it. And growing up, playing football, I was the second smallest kid in my high school till about junior year. And so when I would have to tackle sleds, I would throw my whole body into the sled and I would separate my shoulder. And unfortunately, I would need that to be repaired. So I would go from football practice to see my chiropractor, and my chiropractor would reset my shoulder, and I would go back to football practice and do it all over again. So I got a good working relationship with chiropractic early on in my life, and I realized as I grew up, I really enjoyed helping people, and I wanted to stay in the sports world, and so that's what led me into being a chiropractor.
So if I've got you right from the get-go, your specialty was sports chiropractic, so you weren't intrigued or interested in other areas of study per se.
Oh, absolutely. Chiropractic is one of those really interesting ways of helping people that allows us to help all sorts of different issues. I originally, once again, wanted to start off in the sports world and did a lot of advanced training to make sure that I was able to take care of athletes at a professional level. But then once I got into my normal practice, I'm in an area where there's a lot of families, and I ended up having a lot of families coming in to see me, and I started to really enjoy working with all sorts of different issues, not just those sports related, but those of patients that had, things like headaches or simple back pain or other family issues that, once again, I didn't necessarily think of wanting to take care of, but I did. As I got older, I started my own family, and so I had kids of my own that I had to take care of, and I really enjoyed that as well. So in my practice now, I also take care of a lot of younger kids and babies and pregnant moms, and I find a lot of enjoyment helping them in addition to my professional athletes.
Now, you stepped into this knowing, I assume, that there is a public perception out there of what chiropractors do, what they represent, what the potential hazards are. That's not concerning or wasn't concerning to you even when you first started out?
So I grew up going to a chiropractor. I've been to a chiropractor since I was 3 years old. So I successfully made it through. So I really wasn't worried about the issue of injuring patients as I was deciding what I wanted to do with my life. Obviously, the perception's out there, and a lot of that was due to people not really understanding fully what goes on in a chiropractic office. These days with social media, there's a lot of chiropractors out there that are posting about what happens inside of an office. There's, once again, different TV shows that are showing what really goes on. And so a lot of that fear for patients is going away because they're realizing what's actually happening inside of a chiropractic office with a session. And a lot of that fear is going away.
Ah, okay, I've gotcha. Now you are 47 years old, and as you mentioned, you have a family yourself. So I find that most people in particular professions, when they do something for a living all the time, they're even more fanatical with their own families about care and how they do things. So tell me how you make it a proper balance, meaning that you're not obsessive with your own family, but you're still caring for them.
Yeah, it's really important. When I come to work, all of my patients become part of my family, and for when people come in, they think that, and they really are coming to a doctor, but realistically, once they start to find out what happens here, they realize that I care for them very much like I would care for my own family. And I really would never do anything to my patients that I wouldn't do to my own family. And so, once again, for people who have that fear of coming in, everything that I've done for them, I've also done to my family. And if I felt like there would be any opportunity for them to have issues, I obviously wouldn't do it to them. So I want to make sure that, once again, they're as well taken care of and are able to grow and thrive and live to their optimum, just like my patients.
Sure. Now, I myself, of course, chose a partner who worked in my same industry. I'm guessing that you have not?
This is true. My wife, no, I met while I was in college, and she luckily came with me as I was studying through chiropractic school, but she, no, is not in the chiropractic world.
Ah, is she a creative, or what does...
Yes, so she has done a variety of different things. She's very creative. Right now, she works as a visual merchandiser for one of the local stores, one of the larger department stores in the country. She takes the opportunity to make sure the store looks good and is taken care of properly. She says that she plays Barbie all day long and does a fantastic job at it. So, yes, very lucky.
That brings us to your children, of course. So have either of them shown an inclination to doing community service or being a doctor, anything along your lines, your wife's?
Yeah, no, my kids are fantastic kids, and they've done a variety of different things in their life as well. Their path is different than mine, and so I try to support them as much as I can in their path, whether they want to be in the healthcare field or whether they want to do other things. That's really up to their choice. My daughter's decided to go to college and study computer science, and so her path will be, once again, substantially different. I tried to push her into the medical field, but unfortunately, that's just not what she wanted to do. My son, who knows? He's still got a lot of opportunities out there, and he'll choose his path when it's ready for him.
Oh, how lovely is that? Now, I was reading there's a 76-year-old chiropractor that actually does some beautiful artwork, and it got me to thinking, does the good doctor here do anything in his spare time on a creative level?
I used to do more creative things than I do now. I have more active now, and I try to be more physical now. So outside of the office, I enjoy playing sports, golf. But then I have other interesting hobbies that I find at least to be interesting. I do beekeeping from time to time, and I've been a beekeeper for about 8 years now. So I do a variety of things outside the office as well as inside the office.
Has anyone warned you that maybe you might get hurt doing that? Because that sounds incredibly dangerous.
Yes, when I first told my friends and family that I've got a great idea that I'm going to become a beekeeper, all of them said, "Are you crazy? What are you doing?" And I said, I really wanted a project that I could do with my kids, and I really wanted a project that I could do, once again, in nature. I really liked honey, so I was like, this is just perfect for all of these things. And so I did some research and education and learned how to do this, and I got my kids and my family together. I'm like, all right, here's what we're going to do. And I started setting up a couple hives and got the kids involved, and they're like, this is really cool, for like 10 minutes. And then they realized that it was work and they wanted absolutely nothing to do with it. So after that point, I found enjoyment in it, and so I've continued on for, like I said, the past couple of years.
Okay. Now, I don't want to forget to ask you about this because I think it's pretty extraordinary that you traveled out of the country. I know you had spent time in Hungary. I'd like you to tell us a bit about that, and most importantly, what did you take away from that, not only from as a physician, but as a human, from that experience?
When I was going through school, once again, I had an idea as to what I wanted to do with my practice, and I had a vision as to the type of patient that I wanted to see, but I wanted to make sure that was really right for me. And I had an opportunity to travel to Hungary to work in Hungary for some time. And so while we were in Hungary, we ended up working with a couple different doctors in a athletic college. And so while I was there, Hungary doesn't really have a whole lot of exposure to chiropractic care. And so a lot of people didn't understand why we were there, what we were doing, or some of the ailments that were common to chiropractic. And so we would see all sorts of different patients, and people that had no access to health care, to people that were, millionaires and had absolutely access to absolutely everything. And so we would take in whoever was available, and we would talk to them about what we're doing, and we'd go through a variety of different tests, and once again find ways to help them out. It was really interesting. We had the opportunity to take care of a couple patients, and I had a lady that came in with knee problems. And once again, chiropractic helps out with knees and extremities. It's not as well known as spines, but she had some knee problems, and I said, okay, let's take a look at this. And I did some work on it, and the next day, her husband came in. And her husband came and said, Doc, what did you do to my wife? And I was like, what do you mean, what did I do to your wife? And he's like, she's had knee problems for the past year and a half, and she woke up today and she could walk like normal. She didn't have any issues. She feels fantastic. And I said, well, here's what I did. And he said, well, this is amazing. I'm actually the trainer for some of the Olympic athletes that go to this school. And what I'm going to do is I'm going to send you a whole bunch of our Olympic athletes, and I want you to take a look at them. So while I was there, not only did I get to see, the average person, but then I started taking care of some of the Olympic athletes. And it was really interesting to work with them. And once again, they had never had the physical style of care that I was providing. And same thing, they were like, wow, this is really amazing. They started to see a lot of the benefits. It was really neat to work with those kind of patients.
How nice is that? Look at that. Do you envision yourself maybe doing, I know that some do the Doctors Without Borders, things like that. Would you, if you could find the time, would you do something along those lines?
Yeah, I don't mind doing those kind of things. I really find it's very valuable to provide healthcare to all sorts of different types of patients. And I've worked at community outreach clinics in the past where we just essentially offer free care to those who've never had care in the past. And same kind of thing. You're seeing all sorts of different healthcare issues. And it's incredibly rewarding, once again, to help these people that might have never had any type of opportunity to get better, and you're there able to once again get them to live a better, healthier life and be more productive. Or even once again, those patients that were unable to work, now they can go and get work and really pull themselves up because of the care that you're providing. It's pretty awesome.
Absolutely. As most of us understand, the job of a chiropractor is to do three different things. First of all, it's to help us, or actually help our body heal itself, to provide pain relief, and of course to improve function. So, what do you find yourself 90% of the time in your capacity doing?
Wow, that's a great question. In my practice, we see a variety of different things. A lot of times patients initially come in for pain. Pain is a huge motivator as far as people seeking out health care. Once they come in and we start to figure out what's going on as far as what's damaged and what's causing there to have the pain, then we have to also start to look at, this is what you're having, why are you having this? And then people start to realize, okay, maybe this condition isn't just me having pain here, maybe this pain is because of all these other aspects. And so then you're right, then we start working on all the factors that have caused that pain in the first place. It's important for us to make a patient feel better, but then if a month later they come back in with the exact same issue, then that's a problem. So once again, we want to make sure that they're not only getting better short term, but also hopefully getting better long term.
So chiropractic care has been referred to as a science. I'd like you to talk a bit about that. And I say this because there are lots and lots of reports out there that indicate that there's no real plausible proof or scientific evidence that chiropractic care works. So when people talk about it being a science of sorts, it's a bit confusing, yes?
Maybe. There's a lot of research that actually has gone into chiropractic care. There's, in fact, articles produced literally every day that are published in significant journals that talk about chiropractic care. And in fact, there was actually a report that came out recently from the World Health Organization that said that spinal manipulation and manipulation in general should actually be one of the frontline therapies as opposed to medication. So actually the world itself is coming around to mechanical care as far as being actually frontline for a lot of different issues, specifically low back. So one of the largest reasons that people go to a doctor in the United States is for low back pain. In fact, in some years, it's actually been number one. And if you look at any report out there as to what has the best effect on low back pain, actually it's manipulation. So there's, like I said, a lot of research behind it. And the more and more studies that come out just proves that really it is the place to be for a lot of different issues.
I've gotcha. So apparently there are a total of 11 different types of chiropractors, which I just found out very recently. And so I want to ask you, would you consider yourself to be more of a traditional or functional chiropractor?
I'm pretty much mainstream as far as how I take care of patients. I'm pretty traditional as to how I work with patients. There's patients that look for overall functionality. They see how a patient moves and how they walk, and if there's any issues or incongruencies, then they work on repairing that. I'm more centralized as far as some of the structure is concerned, and if I'm finding incongruencies in the structure, then I'll start with that. If I need to expand, then I can, but I'm more traditional as far as how I manage patients.
I've gotcha. Okay. There's been a comparison made that chiropractic care and physiotherapy are very, very similar, or even in some cases identical to each other. Can you speak on that a bit?
Yeah, there's a lot of crossover, and it's becoming more and more. Traditionally, chiropractic were the only ones that were doing any kind of adjustments or manipulations. Now, chiropractors do a more specific manipulation called an adjustment, and unfortunately, that's kind of murkied the water as far as how people see things. Physical therapists have started to once again recognize the value of manipulations, and so they're doing their own type of manipulations, which are a little less specific than what we do. Chiropractors really are looking to find the smallest degree of changes that need to be made and really work on putting things back into their proper place rather than more of a global manipulation. So there's a lot of crossover. Physical therapists do a lot of work with muscles. Chiropractors do a lot of work with muscles if they want to. It's within their training. Some do it, like I said, as far as functional is concerned. Some of the more traditional might not necessarily do a lot of muscle work, but it's something that is very important in making sure that a patient overall functionality is at its optimum.
So if we back this up a little bit and think to ourselves, okay, most of us don't want to be in a doctor's office regularly. Clearly, most of us want to try to avoid having to do that sort of thing. And I do know that there is a way you can retrain your brain, they call it, where you can actually lower your stress levels, learn how to retrain your brain. Do you feel as if that might help some of us maybe not necessarily not need you, but not need you as often?
Yeah, so your body's a product of the environment that you put yourself in. And your body responds to stress, and it responds to physical stress, chemical stress, emotional stress. And when any of these stresses get out of whack, your body's going to break down and have an inflammation that causes issues. So the better that you can manage those stresses, the less likely you are to need any kind of healthcare professional. So unfortunately, we all encounter stress on a daily basis, and sometimes that gets out of control, and then it's, once again, you need to come in to get it taken care of. So yes, a lot of mental care. A lot of times you see patients, and we'll recommend patients to do different, breathing techniques or different meditation to just calm psychologically their environment. Chemical care, a lot of patients, are not eating properly, or they're not taking, proper nutrition, or they're working around bad chemicals or solvents. All of these are common chemical stresses. Physical stress, obviously, if you're in an accident or if you fall down the stairs. But physical stress can also be repetitive, like your sitting posture, your standing posture, your sleeping posture, things that you're doing at work. All of these kind of physical stresses can also cause issues. So if you can manage all of those stresses, you're just not going to simply need me as often.
Now, we live in a day and age, of course, where all of us are very meticulous about our own health care. Well, we would like to think we're meticulous about it. And so the biggest choice here is, how does one find a quality care chiropractor? So I thought it best to ask someone like yourself, how do you really vet someone and be able to know that you're going to get quality care from that doctor?
Yeah, that's a really tricky question. That's a good one. So there's a lot of different ways to try to find good doctors. Majority of the time, if they've been in practice for a long time, that usually says, hey, this person is able to take care of patients in a good fashion. That's a good way. Some of the schools out there are pretty common that say, hey, an education from Palmer College of Chiropractic is usually a good standing point. There's other colleges out there that are fantastic as well. So finding, a graduate from one of those schools also goes a long way. The hard part is, the old joke, what do you call the person that graduated last from med school? You call them doctor. And so the problem is there's, that in every class, in every profession. And so it's a matter of just finding one that meshes well with what you're looking for as far as healthcare, someone that's got the education and someone that's got the time and the practice to be able to provide what they've learned in school in a proper fashion.
Sure. Now, twofold question here. On one side of the fence, because it's chiropractic care, there may be some that don't necessarily want to jump to say you're an actual practicing doctor, because there is a differentiation between yourself and a medical physician, correct? A regular general physician?
Yeah, and really it comes mostly in name and in education. So once again, the state and the country recognizes chiropractors as doctors. Mm-hmm. And so foundationally, from an education standpoint, what happens is the initial part of school where we learn the anatomy, the physiology, it's all the exact same as what your primary medical doctor would get. That portion is the exact same. Where we differ is how we manage our patients. A primary care physician will learn far more chemistry because traditionally that's how they're managing patients, through drug interactions. Whereas we, as chiropractors, don't prescribe medication. We do our work based on the physical nature of patients. And so we learn a lot more of the structure and function. In the past, when I went to school, a chiropractor would get 5 times the amount of radiology training that an MD would. The reason would be because I see x-rays, because I'm working on bones way more than what an MD would. But they're going to get way more out of the chemistry aspect than I traditionally would. Now, as time goes along, there's more chiropractors that do a lot of chemistry work. And same thing, now there's primary care doctors that do a lot of physical work as well. So it's not as defined as it once was. It's now becoming a very blended and gray.
Okay. So let's say, for instance, you have patients that come in that are older or have reservations, individuals who've had bad experiences, of course, with past doctors. So how do you handle that? How do you make a patient comfortable enough to be able to learn how to trust you?
It's scary. I mean, every person that comes into a doctor, it's a scary event. People don't traditionally just walk into a doctor because they're like, hey, I'm out and about, let's go see what the doctor's doing. Usually they're coming into a doctor because they can't take care of something on their own. And if you can't take care of an ailment or an issue on your own, it's scary. And so every person that walks in the door, we treat with that in mind. We know that they're afraid, they're out of control, their body is not functioning like they wanted to. And so we need to make sure that we go through a proper exam with them and we find out what's going on and we show them this is why you're having the issues. These are the steps that we're going to take to help these issues. And once patients understand why they're out of control, why they're having problems, that calms that fear down quite a bit. Conversely, on the other side of things, it's really important for a doctor to say, as I go through this exam, hey, what you have is not what I take care of. There's plenty of times I find patients that have issues that aren't what I take care of. And I say, here's the deal. I would love to take care of you, but this person is going to take care of you better. You need to go see XYZ practitioner. Sure. And if you can provide them that type of care, once again, they're going to get better faster. And it doesn't do me any good having them not get better in my office. It doesn't do the patient any good. So making sure they're getting the appropriate care, very important. And that also, once again, calms them down and makes sure that they understand that they're in good hands.
I get you. Now, I took a look here and I see that there's generalized sorts of different ways, actual treatments per se. Yep. So can you talk to me a bit about some of your most primary treatments that you find most effective among most of your patients?
The basis of chiropractic care really is through spinal care. I mean, a lot of times people don't realize that the central concept of chiropractic care is that your brain controls your entire body. and your brain talks to your body through nerves. And so if there's any kind of pinching or impairment on your nervous system, it's impossible for your body to work properly or to be healthy. And the most common place for your nerves to get pinched or irritated is when it leaves through your spine. So chiropractors, once again, make sure your spine is functioning right so your nerves can work right so you can be healthy. So foundationally, we always start by working with that spine and making sure that the spine is working at its optimum. And there's a lot of different ways to do that. Majority of time, I use my hands to actually push bones around. I know it sounds crazy to be able to do it. It's actually pretty easy to move bones around. Keeping them in the right place is very hard, but using your hands to move bones around, it's actually pretty easy to do. And that's actually the foundation of chiropractic. Chiro and practos means done with hands. Chiro and practos. And so I'm traditionally in my office using my hands to move around structure.
I've gotcha. Now, again, there are some downsides to this because most of us have already heard that chiropractic care doesn't necessarily, you leave, you don't feel the greatest, you end up having headaches. Some people worry about or even have had a stroke. There are some very serious downsides that people look at and then they automatically jump to assume, this might be a hack or this might be somebody that doesn't know what they're doing. So how do you address concerns like that with people?
Oh, absolutely. And once again, it's the same kind of concept as going to your primary care physician. There's always complications that can happen when you take a drug. There's always risks associated with any kind of medical intervention. And so we do our best to do a variety of different things. First off, like I said, a good exam is really important in establishing what a patient can handle, how they can be worked with, so that you're not doing things to them that might cause them to have any kind of injuries associated with chiropractic care. There's physical care, and so sure, it's just like going to the gym and working out. Going to the gym working out traditionally is very healthy for you, but a lot of times when you're done, you're sore. But your body's growing. It's moving in the right direction. And we have that conversation with patients that sometimes as we work through this process, you're learning a new position. Your body's used to being in its old bad position. And so as we transition to somewhere that's stronger and healthier, there might be some bumps along the way. And that's okay. We'll work through those. And if they're to a degree where it's too uncomfortable, then we'll change our path to try to get you to be where you want to be. So yeah, we work very hard to make sure that patients are only getting the proper care that's, like I said, their body will tolerate. And like I said before, when I'm working with my family, there's nothing that I would do. If I ever felt like there was a chance that they were going to have a stroke while I was working with them, by all means, I wouldn't be doing that with them. So all my patients know that I would never do anything to them that I wouldn't do to my own family.
Now, I know this might sound like an uneducated question, but considering at the start you had talked about sports chiropractic and studying that, but yet you work on small children, yet you work on people that aren't running around active and in sports. So
Sure.
in some ways that kind of seems like an oxymoron, doesn't it?
Absolutely. And that's the beautiful part about chiropractic care is the central dogma of being, your brain talking to your entire body. As long as you have a brain and nervous system, we can work with you. And so while I have specialties in being able to take care of athletes and very high level competitive people, I also have the same expertise in working with little kids and working with babies. And the education that we get, once again, allows us to do that. And the more that you do it, like I said, you just find a joy for it. It takes a little different touch and a little different skill, obviously, when you're working with a little baby who can't communicate to you, hey, my shoulder hurts, hey, my back hurts. They can't do that. So as you're working through exam, you're working with the little baby, and they'll tell you, but like I said, in their own little way. And once you start relieving that, it's magical. And the same goes for, these days, there's a lot of videos out there with animal chiropractors. And the same thing, an animal can't say, hey, I'm hurting right here. Hey, this needs help right here. And so as the doctors are working with these animals and they're finding issues and they start relieving that, and the dogs and the cats and the giraffes all are like, oh my gosh, I'm moving better, and they're running around like crazy. I mean, it's such a cool thing to see. So
Sure.
Very similar.
Chiropractic company, how long have you been here in Wisconsin?
So chiropractic company's been around for over 40 years at this point. I've been in practice for 21 years, and so when I joined on, we had just started to have some growth into the company, and since that time, we've grown now to having 21 offices through Greater Milwaukee, and now have over 40 doctors that work with us.
Now, when we talk about your client base, is it typically new patients, existing patients coming back? Where is the majority of your base coming from?
So we see patients that have been with us for the entire 21 years that I've been in practice. We have a lot of new patients that are coming in as well that are new to chiropractic care. Once again, they see us on YouTube and they see us on all these other social medias and they say, wow, this is amazing, I want to try that. And so this is a great opportunity for them to experience what chiropractic care is all about. We get a lot of patients through word of mouth. We don't really advertise a whole lot. The majority of our patients come from giving good care to other patients. And when they get good care, they say, hey, you got to come on in. And so that's where the majority of our patients come in. We have a large group of patients that come from other doctors in the area as well that know that the people that are coming in or that are being referred by them are going to get good care. So we see a lot of people through that as well.
If I were to ask you the biggest difference between yourself and, let's say, any other chiropractor here, what would that answer look like? So
for me, once again, I've been in practice for 21 years, but we have phenomenal doctors that are here in the office, and not only my office, but throughout the entire company. We work really hard on making sure that all the doctors are well educated, well trained, well experienced. We do a lot of work to make sure that they are able to practice at the top of the game, not just in the company, but throughout the state and country. For me, like I said, when you come into my office, you get 21 years of me working with patients.
And likewise, of course, I know that you have an office staff that complements all of you. Are they trained in any form of this? Do they need to be?
So in our office, because of how many patients we're seeing, we really have to work with a lot of precision, and we have a lot of moving parts here in the office. So yes, our staff also is very highly trained, and they do a lot of work with helping to manage some of the patients that I can't provide time for. So I'll have some of my staff help me out as far as that's concerned.
Okay. Now walk me through, if the average person walks through the door, maybe doesn't even know what's wrong with them, or even sure that they need chiropractic care,
Sure.
Or what to expect once they're here for you to assess them. So walk me through that process.
Yeah, and we, once again, have seen so much more of that now that people are seeing us on social media and they say, man, I don't really know if I need to be here or not, but I want to know more about what's going on. And so when a patient comes in, they'll fill out paperwork just like every other medical, facility. Unfortunately, the state and the government makes it so that those insurances, those forms are way more than what they should be. But once you finally make it through the paperwork, then you'll meet with a doctor, and the doctor will talk to you about if there's been any history of issues, and then once again talk to you about if there's been any other concerns that you have from a healthcare standpoint. And if there are, great, then we'll address trying to find out what's going on with those. Once we figure out what's going on and what your healthcare goals are, then we'll come up with a plan as far as how to manage those goals. Some people, like we talked about before, are only here for pain management. Great. We'll do some work to try to make you feel better. Some people here are for health and wellness. They want their body to function better, and so we'll try to get them on a program to allow for that. Some people here are just for wellness care. So people come in and they say, Doc, I've got all this stress. I don't want it to cause damage. I'm only going to come in every once in a while just to make sure that my body's functioning great. I have a lot of patients that come in for performance care as well. So a lot of my professional athletes, they'll come in and it's not like, hey, my back hurts during my golf swing, but you know what? I'd really like to shave a couple strokes off my swing. Great. Let's work on figuring out why that's going on and work on performance care.
So I'm guessing if you would have probably had Giannis or one of the Bucks in here, maybe we wouldn't have lost then.
I didn't say that at all. I'm sure they're under fantastic care. But you'll find that every professional organization, as far as sports is concerned, has a doctor that works for them.
Sure.
And a lot of the teams are going away from just a single chiropractor to having 2, 3, 4 chiropractors that are working with the team, just because of the volume of work that these athletes truly need on their body.
Okay.
It's pretty amazing.
Well, the million-dollar question is always for most of us, at what point does the doctor know that we are where we need to be so that we're not literally living here or being married to you forever, so to speak?
Absolutely. Everybody's healthcare goals are totally different, and everybody has their own place that they want to be in. So once they achieve their goals, fantastic. And so, like I said, if pain is your goal, if your goal is just to get out of pain, great. We're really good about helping provide that. Like I said, statistically, we're the best for low back pain. If your goal is to live a healthier, better life, well, once you stop living a healthier life or you stop living, then that's time for you to not see a chiropractor. And I've heard other people use the example of going to a dentist. So once again, people go to a dentist. Why do they go to a dentist? Because they're continually eating and using those teeth. Well, you're using your spine as well. You use it every day, and your body encounters stress every day. So a lot of these patients want to use chiropractic care for the rest of their life.
So if you could briefly say to me that besides manipulations, what other services do you offer here in office?
Yeah, we do a lot of soft tissue work here as well. There's a lot of different physical therapy modalities that help to traction your spine. We do a lot of rehab as far as helping the muscles to strengthen and stabilize. We do provide laser therapy in our office. We don't do that through every office, but here in this location we do. Ultrasound therapies, a variety of different things to help. And once again, it depends on the injured tissue and what's going to get them to be healthier the fastest.
Okay, and age range for treatment starts at?
Literally, I've adjusted patients that are minutes old. My kids literally went from my wife to me and then off to the doctor. So literally minutes old, I've taken care of kids. All the way, I have patients that are into their hundreds. So there really is virtually no limitations.
Now, it's interesting. I was recently reading and I had saw a statistic where it says currently there are about 63% of the population that actually trust chiropractors at this point. Would you say that there is one particular, in your own mind, one reason why you think people have come around to the mentality of that?
Like I said, a lot of it is just seeing what happens in an office. A lot of times people have this perception that it's weird, it's scary, all these other things, but they didn't really know what happens inside of an office. And so once people would see an adjustment and realize, oh, that's what's happening, oh, that's not as bad as I thought it would be. And then once they feel that experience and they're like, oh my gosh, this is fantastic, I've been waiting for this forever, then they realize that, yeah, this is really a great place for me to be.
Sure. Now, looking at 2024, as we all know, as time goes by, technology improves and things change. And so it sounds like there's some newer technology that they've been utilizing lately as far as for chiropractic care. We're all afraid of the big AI. And so I'm curious to ask you about, like, for instance, the AI-powered diagnostics. Are you a fan of this? Do you even think this could be helpful?
Anything that we can use to give better care to a patient is fantastic. What provides best outcomes is what we're looking for. Unfortunately, when we do what we do, chiropractic, like we said, is done with hands. There's not a lot that you can do to replace that. And a lot of it, once again, like I said, there's a lot of art that has to be done by the practitioner. As time goes along, there might be more ways that come up that help us to provide better care. I'm all for it. Like I said, the more that we can move a patient towards their healthcare goals, I'm all for it.
One thing I've read a good deal about is the laser and spinal decompression stuff. Now, have you used that? Have you done that yourself?
We do a variety of different laser therapy, once again, here in our office. I've worked with laser therapy probably for 10, 15 years. A lot of people think that this is a newer technology, but it's becoming more popular. It's becoming more refined and, once again, more mainstream. But it's actually been around for quite a while. And so now a lot of practitioners are finding better ways to use it. We talk about stress and compression, and so a lot of times when we work with patients, the more that we can remove of this stress, the more we can remove of this compression, the better off they'll function better, they'll be healthier.
Sure. Do you envision yourself offering the remote services? Because I know some doctors do.
So, in fact, it was funny, I just read an article on concierge type services. I don't particularly find that I will do that as a mainstream for my office. I take care of a lot of patients here in the office, and I have a lot of tools to use here to get the best results. I do provide care away from the office, but it's usually for specific reasons. So when I go to do sporting events and I'm working at the U.S. Open or the U.S. Senior Open, and I'll be outside of the office working with those athletes, then I'll do more outside care. But I don't necessarily think, personally for me, I'll provide in-home concierge care, but I do feel like there's a need for that. There's some people that are simply unable to get out, unable to make it into the office, and so having that service could really help them out quite a bit.
Okay. 2 final questions for you. First of all, if you would please explain to me probably the most challenging or difficult case you've ever had, besides myself, of course.
Difficult cases. So that's a good question. Difficult can be in a variety of different ways. One of the most challenging cases actually happened to me early on, where once again a mom came in. She's a new mother, and I'm taking care of her, and she had a lot of issues through her pregnancy and a lot of issues after the pregnancy. And so she's getting better and getting healthier over after giving birth. A couple weeks, couple months go by, and she says, "Doc, I'm really struggling quite a bit." And I'm saying, "You're adjusting really well. You're getting healthier." And she said, "It's not with me. It's with my baby." And she said that unfortunately her child had gotten to a point where it started off life, doing things properly, but then had stopped growing, had stopped developing, and kind of gotten to a point where it was almost clinically failure to thrive. And so she's like, I'm trying everything. The doctors are trying everything, and we're just not getting anywhere. And she said, is there anything that you can point me to help out? Is there any way that you can, give me a doctor that can help? And I said, well, bring them in. Let me see what's going on, and I'll try to give you some direction as to where to go. And so after looking at this baby, once again, there was struggles all over the place. And so I found a lot of issues that I could take care of. And I said, okay, here's the deal. I'm going to do what I do, and I'm going to help out the way that I help out. But I also want you to continue on with these people. And sure enough, as we started to work, the child started to turn. And it started to grow and started to get healthy and started to eat again and started to breathe properly again. And all of these things just started to snowball in the right direction. So instead of this patient spiraling downward, we turned it around and started to get them spiraling, going back in the right direction. So when you see that, the challenge of working with someone that's close to death is really, once again, an awful thing. But to be able to make them thrive and live is truly amazing. And oddly enough, this patient is now in their teens, and they're actually doing very well. I saw this patient actually this week, and so they are once again playing football in high school and living virtually a perfect normal life. And so those kind of things, like I said, it's awesome. And we see stuff like that, not necessarily to that degree, virtually every day in our office.
Now, I could speak all day and ask all the right questions. However, I'm not you. I always feel that my guests are the best representations of themselves. So please tell my listening audience what you want them to really know or remember about you.
About me. I, as a practitioner, love what I do. And I think that a lot of doctors you'll find that have made it this long in their career truly do. And a lot of people you'll find in their jobs that they're good at just because it's what they love. It's in their heart. And that's a lot of me, is I truly enjoy seeing people live a healthier life, being better, being able to go be better husbands and wives and live fuller lives. I love seeing that aspect in people. So for me as a person, my job really isn't a job. It's something that fills my soul because I know that people are able to do what they need to do.
Now, remind me again, chiropractic company is open Monday through Friday, correct?
Correct.
Set hours every day, or?
Each location is a little different. My office is open 8 to 6, Monday through Friday. Some doctors, we do have Saturday hours through a couple of our clinics, once again, throughout greater Milwaukee. But yes, majority of them are set hours Monday through Friday.
Gotcha. And how can people find you on social media?
So I am on social media. Dr. Van Scoyk is my Instagram, and we are on Facebook through our company, through Chiropractic Company. So those are easiest ways to find me.
And I assume that you also have an Instagram profile or LinkedIn, any of those?
I do have both Instagram and LinkedIn. Probably not posted to nearly as much as some people would like me to post to them, but I do try to interact with my people as much as I can.
It's not very often to walk into someone's office after you've lost probably the most important person to you and put your body and your faith into that person. So I'm here to personally attest that not only have I still been here after a year, but I actually trust the person that I am seeing, and I actually continue to consult him, and I continue to listen to him, and I don't doubt that he is probably one of the more top-notch doctors in the city, so I highly recommend him. So, Dr. Allen, thank you so much.
Thank you.
Appreciate it. All right, doctor, since this is your field of study, we're in your room, or basically in your treatment area, so please walk me through what a typical treatment looks like.
Sure. So when I first work with patients, first thing I would do is just get a general overview as to what the spine presents with. As we go through an exam, we feel for where there's issues. And once we figure out where there's issues, then we can work on correcting those issues. When I start working with a patient, I traditionally start with just kind of warming up and stretching out the tissues. Muscles attached to bones. So if I can get the muscles warmed up, loosed, and relaxed, it'll go a long way with helping make moving the bones a lot easier. Like I said, moving bones is actually pretty easy to do, so we want to make sure that the body is capable of getting them into place in a very comfortable way. So after adjusting that, once we find, once again, the bones that we want to adjust, we know what direction and how far we need to move them. So traditionally, I just put my hands on either side of the joint, kind of shake it back and forth to make sure the patient is feeling comfortable. What I'll have the patient do is take a deep breath in and then let it all the way out. And when you let it out, I follow you down with my hands to the point where your breath is almost all the way out of your body. When that happens, those joints end up getting really stiff and stuck. When a joint gets really stiff and stuck, we can give it a little push and move it back in place. When we give it a little push and move it back in place, the patient usually hears like a little pop or a crunch as those bones go back to where they need to go. So that's traditionally how we make an adjustment. And it would look something like this. Go ahead and take a nice deep breath in for me. And let it out all the way. And we follow it down real nice and easy, and we give a little push. And that's it. It's really simple. And that's how we work in through this area of the spine. As we move on down, we do another one. Go take another nice deep breath in, and let it out all the way. Follow it down, give a little push, and there it goes. Now on different videos, you'll hear all sorts of pops and crunches and things that just echo and reverberate. And sometimes you hear a loud one like that, and sometimes you only hear like small ones and feel it throughout your body. So each time that you get adjusted, it's a little different. As we work on the low back and pelvis, we need to move the bones in a couple different directions. So we traditionally adjust in a little different way. There's lots of different ways to adjust patients, and this is kind of the foundation way. And if the patient needs certain different things, then we can change that foundation. But to adjust the low back, what I traditionally have a patient do is lay on their side. And I have them lay on their side facing me. To get the bones to be stiff and stuck, we traditionally tie a patient up into like a little ball. So we'll put the arms together, put them along these lines, and essentially what I do is put my hand on their back and I stretch the patient out. Once again, the more decompressed I can get that joint, the easier it is to move. And you'll see this on TV and in videos a lot. Once we get a patient where it's really stiff and stuck, we give it just a nice little push and move it back in place. And you'll hear lots of pops and crunches as that bone moves back to where it needs to go. Go ahead and lay your back. Each time a patient comes in, we'll feel how the structure is working. We'll move it around, and then we'll see how the bones are working. We'll tip it back and forth from side to side, turn it from side to side, and we'll feel where the joints are misaligned. Once we know where the joint is misaligned, we typically tip it and turn it till the joint locks. Once the joint locks, you give it a little push and move it back in place, just like that. Once again, as that happens, it allows for that bone to slide back in place. It's a lot like a big Jenga tower, and someone's taken some of the blocks and pushed them over from side to side. The tower hasn't fallen, but it's not very stable. So if I push those blocks back in place, the tower gets to do what it's supposed to do.
Now, I do see other instruments in here, so is it usually just your hands, or do you utilize outside instruments?
So, we do use other instruments as well. A common instrument in a chiropractic office is called an activator. And we can use an activator to provide that same force, but in a controlled manner. So we can do it in a certain line of direction if we need to. For instance, sometimes I work on a hip. And so if a patient comes in with a hip restriction, sometimes I find a spot on the hip that I want to adjust, and I'll put the activator on it, and I'll give it a little click. Quite simply, it's just a real easy way to move that in place. This is also very effective in some of my patients that can't tolerate a forceful adjustment. Patients who have, less bone strength, or babies, or elderly. Sometimes they can't withstand that type of a force. It's not very comfortable on them, so we can utilize this simple tool to provide that force.
As well as, of course, your x-ray room, because I know that you do take x-rays, of course, to be able to assess someone's condition as well.
Big part of our exam is many times shooting x-rays, absolutely.
I gotcha. So it's a pretty simplistic process, as we see here.
Like I said, moving bones, it does not take a whole lot of work to be able to move them. The problem is knowing the right direction to move them, knowing the right distance to move them, when to move them, when not to move them, and then once we do move them, keeping them in place. And that's the hardest part, is keeping them where they're supposed to be. And that's where the repetition comes in. A lot of times you go to a doctor, a chiropractic, and they'll say, hey, we need to see you a couple times a week for quite some time, because we have to retrain those joints, and we have to retrain all the connective tissue to learn a new, better, stronger position.
So if I'm getting this right, you're probably in and out of here within 10 minutes?
Each adjustment is a little different. Each patient requires different things. Sometimes I'm in and out of a room in a couple minutes. Sometimes it's a little bit longer than that.
Part treatment, part mental health as well, right? Because there is a mental health aspect as well?
A lot of times we talk about stress, and once again, psychological stress. So if there's certain aspects of a patient's day that are causing them to have problems, if we can work through those, it makes the adjustment smoother, easier, and hold a lot better.
And one other question on the treatment portion. A typical person to start off will be looking at how many treatments per week?
So each person's, once again, healthcare goals are different. If a patient comes in with acute issues, a lot of times we'll see a patient 3 to 5 times a week. We might do different treatments each day, but a lot of times that early repetition is really important. And we traditionally do that for about a month, and then we reassess. Every state guideline shows that you need to do periodic reassessments, whether that's every couple of weeks or every couple of months. And so we need to make sure that we're doing proper reassessments. Based on those reassessments, we can decide, does the patient need care to continue on, or if they've achieved their healthcare goals, and then they can end care at that point.
It looks like you're doing very big things in a relatively small office.
It is. We do a lot here. We see a lot of patients, and we get a lot of people better every single day. It's pretty awesome in this office.